Extract 1. Questions 1 to 12.
You hear a GP talking to a patient called Daniel Anderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, it's Daniel, isn't it?
Yes, Daniel Anderson, that's right. Hi, Dr. Hampton.
I haven't seen you for quite a while. What brings you in today?
Yeah, I probably should have come in before now.
Okay, well, that's fine. So, how can I help?
Well, basically, over the last couple of weeks, I play football on Sundays, and a bit more than a couple of weeks ago, I was getting a bit more tired than I used to be. Like, I'd get out of breath in the game, I'd get puffed out. But more recently, it's been little things like walking up and down the stairs and stuff like that. That's got me a bit tired as well. So, I was just wondering what's wrong with me, really?
Okay. When did you first start feeling poorly? Can you remember?
That's the thing, I had a cold, you see. Well, I thought it was a cold, I had a sore throat, and I was quite under the weather for that, but I've never really recovered since then.
And how long ago was that?
That'd be about a couple of months ago now.
Couple of months. Did we see you with that?
So I made an appointment, on the phone, but I didn't come in the end.
No, I didn't see you on the computer. So, you just basically managed that yourself and,
Yeah, I thought it was getting better, but I suppose that's never really gone away entirely. So maybe it was something more than a cold. I don't know.
Okay. What symptoms were you getting with that cold at the time?
Bad sore throat. My glands felt quite big as well, so, I was just really tired, really, no energy.
Were you short of breath at that time during the cold?
Yes, but not as much now. That's why I've come in now, because it's gotten worse. It's got a bit more noticeable. But the cold symptoms have gone away now, pretty much. I still get a bit of a sore throat every now and again.
Right, okay. When you're at rest, do you get short of breath?
No.
No. Okay. Ever had asthma?
No, I've never had asthma or any sort of chest problems as far as I can remember. Nothing like that.
And do you have a particular diet? Are you a vegetarian or anything?
No, I'm not a vegetarian, but I hardly eat any meat either. I eat a lot of fried rice and instant noodles from the university cafeteria. The food's quite cheap. I know I should eat fruit and vegetables, but I'm a student. I suppose my diet is terrible, if I think about it. Some days, all I'd have is instant noodles and some hot chips and the usual 4 or 5 cups of coffee.
You drink a lot of coffee then?
Yeah, it keeps me going with all the assignments and things.
Okay. Have you noticed any problems with abdominal pain or indigestion?
No, nothing severe, no.
Nothing severe. Have you had some from time to time?
No, not really. Well, I've had some mild discomfort occasionally, but that could just be indigestion, I suppose. I don't know, it's something I've had on and off for years, really. It's nothing new.
It's nothing new, okay. Any nausea or vomiting with this?
No.
What about your bowels? Have they been working normally?
Yes, been fine. I haven't had any diarrhea or anything.
In particular, not past any black or very dark motions?
No, nothing like that.
And what about family history? Is there a family history of people getting anemic, for example, for any reason, as far as you're aware?
No, not that I can think of.
No one's had any sort of blood disorders or anything?
No, nothing like that, as far as I'm aware. My parents are very fit and active, and my brother doesn't have any health problems that I know about.
Right, so they're all fine as far as you know. So, Daniel, did you have an idea in your own mind what this might be?
I thought it maybe could have been related to the cold I had, because one of my friends did have glandular fever around, like, a few months ago, because my glands were up. I thought it could be related to that.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Eugenius. For questions 13 to 24, complete the following notes with the word or short pause. You now have 30 seconds to look at the notes.
Hello, Doctor. Good morning.
Good morning. What's your problem?
Doctor, he is my son, Eugenius. A few hours ago, he fell off his bicycle. He was not wearing a helmet. He went unconscious for a few seconds. He complains of neck pain now.
Does he have any other illness?
No, Doctor.
Okay, what's his age?
12 years, Doctor.
Any previous injuries?
Very minor injuries, Doctor.
Was he taking any medicines?
No, Doctor.
Does he smoke or drink?
No, Doctor.
Can you tell me more about family history of illness?
Absolutely no illness in our family, Doctor.
Any weight loss or gain recently?
No, Doctor.
Well, his physical examination shows his blood pressure 150/75, pulse rate 80, respirations 18, temperature 37.4, saturation 97% on room air. He is moderately obese. His neck is symmetric, the trachea is in the midline, and there are no masses. No crepitus is palpated. The thyroid is palpable, not enlarged, smooth, moves with swallowing, and has no palpable masses. Normal respiratory effort. There is no intercostal retraction or action by the accessory muscles. Normal breath sounds bilaterally with no rhonchi, wheezing, or rubs. The point of maximal impulse is palpable at the 5 ICS in the MCL. No thrills on palpitation. S1 and S2 are easily audible. No audible S3, S4, murmur, click, or rub. Abdominal aorta is not palpable. No audible abdominal brutes. Femoral pulses are 3+ bilaterally without audible brutes. Extremities show no edema or varicosities. Gastrointestinal investigation shows no palpable tenderness or masses. Liver and spleen are percussed, but not palpable under the costal margins. No evidence for umbilical or groin hernia. No lymphatic nodes over 3 mm in the neck, axilla, or groins. Musculoskeletal test shows normal gait and station, symmetric muscle strength and normal tone without signs of atrophy or abnormal movements. There is a hematoma in the forehead and one in the occipital scalp, and there are abrasions in the upper extremities and abrasions on the knees. No induration or subcutaneous nodules to palpitation. I have reviewed his chest X-ray and it is normal, right hand X-ray, which is normal, and an MRI of the head, which is also normal. He has concussion, facial abrasion, scalp laceration, and knee abrasions. Admit him today and his health condition will be monitored by our team. We have observation team working 24 hours.
That is the end of Part A. Now turn over and look at Part B. Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear a nurse reporting to a medical team about a patient. Now read the question.
We have one geriatric patient, Mr. Drake, in room 242. He's had 2 strokes in the past, and there's some cognitive impairment. The reason he was admitted from his nursing home yesterday was essentially that he's been refusing food for 3 days. But there are definitely signs of depression. Last night, the duty nurse reported that he was saying, "I want to die, I want to die," though he didn't say this to me personally. Apparently, his wife's in another nursing home. They have no contact and she's not been able to visit him. So we're going to try to figure out how to get them together, because that'll give him something to look forward to. In the meantime, the plan is to get him up. We'll start with the cardiac chair until physiotherapy can see him.
Question 26. You hear a hospital nurse talking to a patient about oxygen therapy. Now read the question.
Mr. Anand, here's the oxygen mask, which we agreed would be a good idea while you're having breathing problems.
Oh, thanks.
Now, it's really easy to operate. Have you used one before?
Yeah, at home last year for a fortnight. I think I remember what to do.
Good. So you're aware of the effect on your mouth?
I'll keep drinking a little and often, because otherwise the oxygen can dry it out, can't it?
That's right. You've got to keep hydrated, so do shout out if your water jug needs refilling. Do you have any other concerns?
Well, last time the skin here, behind my ears, got quite painful and raw because of the elastic straps tight against it.
Well, if you use these little pads and loosen the straps, it'll stop that happening.
Great.
Question 27. You hear a surgeon briefing her team about a patient they will operate on later in the day. Now read the question.
And the next on today's list is Freddie, who's a cloacal extrophy with a cross-fused ectopic kidney. He has a history of respiratory infections too, and there's a high risk of him getting another one following the procedure, so he'll need to be in the intensive care unit. We obviously can't start until we hear there's a place for him there, but they're calling us shortly and they sounded pretty positive this morning. This is today's main case and I'd like to get started around midday so we can spend the whole afternoon focused on this.
Question 28. You hear 2 hospital nurses talking about a patient's medication. Now read the question.
Now, Mrs. Thompson here needs IV administration of her antibiotics. Okay, I was a bit worried about her swallowing reflex, actually. She's hardly touched her food since she came in. But she's been assessed by the therapist, who said there wasn't a problem.
She's been unable to keep anything down since yesterday morning anyhow, so there's no point trying to give her the tablets.
I see her operation's set for Friday morning, so she won't be able to eat in any case in another 72 hours. But that still gives us a window for the antibiotics. We'd still better use IV to be on the safe side.
No problem. I'll set up the drips straight away.
Question 29. You hear a pharmacist talking to a customer about head lice in children. Now read the question. Hello, can I help you?
Yes. There's nits going around my son's school. I need something that'll stop him getting them, 'cause they spread like wildfire, don't they?
Has he got any symptoms? Has he been itchy or had a rash?
I'm not saying he's got nits, it's more that I want to make sure he doesn't get them.
I understand that, but unless your son's been confirmed as having head lice, it isn't advisable to use medication.
I was told there was a lotion you could buy over the counter. I mean, if the nits jump from one kid's hair to another, it's only a matter of time. What's the point in waiting?
Well, first of all, they don't jump. To get head lice, your son needs to be in very close contact with another child who has them. Even then, it's by no means a foregone conclusion. Also, if they're detected early enough, you might get rid of them by combing alone. If that didn't work, well, then we'd recommend a lotion. Question 30. You hear an ophthalmic consultant giving feedback to a trainee who has just carried out an eye examination. Now read the question.
So, were you happy with the examination?
I think it was okay overall, but it was hard carrying out the procedures while having to deal with the patient's questions at the same time.
Yes, that can be hard. But there were lots of good things. Reassuring the patient when necessary certainly helped the process. The patient seemed rather confused sometimes about what you wanted him to do, though. That's something to work on. Think about effective ways of communicating what's required. You described in full the reasons for the various procedures, and adapting your language style to this particular patient did seem to relax him. That sort of approach puts patients at ease.
Right, thanks.
That is the end of Part B. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1, questions 31 to 36. You hear the doctor briefing his staff about the pathology report. You have 90 seconds to read questions 31 to 36.
Hello, Doctor. Will you please explain to me about the type of information included in a pathology report?
Well, often a pathology report of surgical specimens is complex and very long. These are divided into many subheadings. The general information includes the name of the patient, the medical report number, the date of the biopsy or surgery, and the unique number of the specimen that is assigned in the lab. The next set of information often contains patient information provided by the doctor who resected the tissue sample. This information includes the special requests made to the pathologist and the medical history. For instance, if a lymph node sample is being resected from a patient with cancer in another organ, the doctor will indicate the type of the original cancer. This is useful in guiding the pathologist's selection of special tests that may be required to assess if any cancer in that lymph node is a metastasis from the original cancer, or else a new cancer that started in the lymph node. Gross description is the next part of the information. Here, the term gross means the details seen without using a microscope, by simply looking at it and feeling the tissue sample and measuring. In the case of a small biopsy, the gross description would be a few sentences listing its color, size, and consistency. Gross description would also include the number of tissue-containing cassettes submitted for biopsy. However, in the case of a larger biopsy or tissue specimen, for instance a mastectomy for breast cancer, this will have lengthy gross descriptions, including the size of the entire piece of tissue, size of the cancer tumor, how close the cancer tumor is to the nearest surgical margin of the specimen, how many lymph nodes were detected in the underarm area, and the particulars of the non-cancer tissues. A note of where tissue was taken from is also included. The gross description is very short for cryptology specimens. That usually notes the number of smears or slides made by the doctor. If the specimen is a body fluid, its volume and color are indicated. Microscopic description will include details such as the appearance of cancer cells, how these cells are arranged together, and the extent of invasion to the nearby tissue in the specimen. Results of any other investigations made, such as flow cytometry, histochemical, etc., may be indicated in the microscopic description or in an exclusive section. Diagnosis is the most significant part of the pathology report. Although this is the bottom line of the pathology, this section can be mentioned at the top or bottom of the report. The doctor relies on this final diagnosis information to decide on the best treatment methodologies. In case the diagnosis is made for a cancer tumor, this section will indicate the exact type of cancer and will include the grade of cancer. Once the final diagnosis is complete, the pathologist may want to include any additional notes for the doctors taking care of the patient. Often, this comment section is used to recommend further diagnosis or to clarify a concern.
Now turn over and look at Extract 2, questions 7 to 12. You hear a physician called Dr. Hubert Johnson discuss improving efficiency at a healthcare practice. You now have 90 seconds to read questions 37 to 42.
Hi everyone, my name's Dr. Hubert Johnson, and I've been asked to speak to you about my experiences in the healthcare industry concerning something that affects all health professionals, improving efficiency. It seems to be a given these days that practices will struggle with a lack of efficiency. We've actually found that this expectation in and of itself can reduce efficiency and increase delays even further. In a recent survey, when patients were asked why they arrived late to their appointments, 30% said that they had assumed that the previous appointment would run long. Patients expect to be kept waiting, and to some extent, we expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients. So let me start by telling you about the efficiency I observed in a practice I visited a couple of weeks ago. At this practice, patients could not make appointments online, but they could either phone up or make an appointment in person. There were never more than 2 receptionists working in the morning, and the practice generally scheduled 80 appointments each day. Patients who were not attending a follow-up appointment were required to make their appointment on the day of. Can you imagine what that practice was like in the first couple of hours they were open? The receptionists were inundated by calls and walk-ins trying to schedule appointments. As you can imagine, patients who had seen what the practice was like in the morning expected that if they didn't have the first slot of the day, they'd be delayed by at least 10 minutes. So naturally, they arrived to their appointment 10 minutes late. One of the most important things you really must address in your practice in order to improve efficiency is the way you present your practice to patients. If they believe that you are always running late, guess what? They'll be running late too. Now, let's think for a moment about what needs to be done on the patient's end before an appointment can take place. You might be thinking that there are only 2 steps to the process. 1, the patient books an appointment, and 2, the patient arrives at the practice in time for their appointment. Well, we healthcare professionals often forget that there's actually a step that comes before this. Firstly, the patient must decide that their issue is significant enough to warrant an appointment. So, about a decade ago, my practice was really struggling from a lack of efficiency. I was working extremely long hours to try to accommodate everyone, and I was becoming increasingly frustrated with conducting appointments that didn't seem strictly necessary. I got to thinking about how I might be able to help patients to reconsider their initial assumption when booking appointments and to treat minor issues at home. At the same time, I did not want my patients to feel unsupported. I decided that I would begin to give weekly presentations in the evenings about self-care. As I tended to see a multitude of patients coming in for similar issues that they could actually treat themselves, each week I focused on a different common theme. The presentations lasted for just 1 hour, but I found that they resulted in 7 fewer unnecessary appointments each week. These days, of course, I no longer have to give a physical presentation. Thanks to modern technology, I simply upload instructional videos to our practice's website. We also email these videos out to patients periodically. We can and should make use of technology as a tool in our practices to help us improve efficiency. However, it's important to note that while many, perhaps even the majority of your patients will be capable of using technology to arrange their appointments, there are many people uncomfortable or unable to use technology, so you must always make sure that these patients are accommodated too. Providing your patients with more options rather than replacing old options is often the best practice for improving efficiency. Now, let's move on to look at a practice that used technology in a surprising way.